From the manufacturers of the original Lma airway comes yet another revolutionary advance, the Lma Pro Seal. The Lma Pro Seal is the latest addition to the Lma range of airways, offering, as well as the features of the Lma Classic, further benefits for improved airway management. The Lma Pro Seal is a natural evolution of the Lma airway, as its inventor, Dr. Archie Brain, explains.
It's important to realize that the Lma Pro Seal didn't just appear overnight. In fact, there are some 18 years of development work behind it. For example, this is one of the earlier prototypes in which you can see a double tube construction on a very early laryngeal mask, and the second tube opens out into the upper esophageal sphincteral region. Some 5 years later, I was still trying to work out and overcome various complex design problems. So I think that the important message is that the Lma Pro Seal is not really quite as simple as it appears.
The Lma Pro Seal has four main components: a cuffed mask, an inflation line with pilot balloon, an airway tube, and a drain tube. The mask has been designed to conform to the contours of the hypopharynx, with its lumen facing the laryngeal opening. It has a main cuff that seals around the laryngeal opening, and a rear cuff which helps to increase the seal pressure and improve patient tolerance. Attached to the mask is an inflation line with a pilot balloon and valve for inflating and deflating the cuffs. The airway tube is wire-reinforced for flexibility and to prevent collapse. It terminates at a standard 15mm connector. The drain tube passes lateral to the airway tube and traverses the floor of the mask to open in the distal end. This opening lies directly at the upper esophageal sphincter when correctly positioned. This fiber optic view shows how the position of the drain tube inside the cuff and the increased depth of the mask bowl prevent the epiglottis from occluding the airway tube, eliminating the need for aperture bars. The flexible double tube arrangement reduces the risk of mask rotation, and the built-in bite block helps prevent airway obstruction. A removable introducer tool has been designed for ease of insertion and fits into a retaining strap. This strap also accommodates the index finger or thumb for manual insertion. The Lma Pro Seal is a reusable device which is entirely latex-free and is warranted for up to 40 uses. The key feature of this device is the separation of the alimentary and respiratory tracts. The drain tube is designed to resist collapse when the device is inflated. In the event of regurgitation, secretions are channeled away from the respiratory tract through the drain tube. During positive pressure ventilation, the drain tube also serves to divert any inspired gas leaks away from the esophagus, reducing the risk of inadvertent gastric insufflation. In addition, the drain tube can facilitate gastric drainage during surgery by allowing blind insertion of a gastric tube in any patient position. In this fiber optic view, the opening of the drain tube lies directly at the upper esophageal sphincter, allowing fluid and gases to be removed from the stomach. The decision whether to pass a gastric tube must be made on clinical grounds. A study in fresh cadavers showed that the correctly placed Lma Pro Seal prevents aspiration of regurgitated fluid in cadavers. Dr. Stephen Deerdorf, professor of anesthesiology at the VA Medical Center, Indianapolis, describes the benefits of the dual tube arrangement.
The stomach represents a great unknown even in fasted patients. It's not unusual in a fasted patient to find 100, 200 cc's of gastric contents still in the stomach. If I can't evacuate that, then I think that's preferable. The other advantage is even if you can't empty the stomach, if there's a gas bubble or if there's some pressure in the stomach, then I can relieve that with a gastric tube as well.
The softer cuff material, deeper mask bowl, and more anatomical cuff shape provide a more effective seal at lower mucosal pressures. Results of a preliminary crossover comparison with the Lma Classic concluded that at 60 centimeters of water intracuff pressure, the Lma Pro Seal gave twice the seal pressure of the Lma Classic. Although it may be used in spontaneously breathing patients, the Lma Pro Seal has been designed for use in positive pressure ventilation, with or without muscle relaxants. Dr. William Rosenblatt, Associate Professor of Anesthesiology at Yale University, was the first to use the Lma Pro Seal in the United States.
I think the Lma Pro Seal device will show a benefit in terms of using positive pressure ventilation for a variety of surgical cases. With the separation of the alimentary tract and the respiratory tract, I know I feel more comfortable delivering positive pressure ventilation. Many of my colleagues do too. I have a higher seal against the larynx, and I know that I can access the alimentary tract either passively through the gastric drain alone or by passing a gastric tube down into the esophagus and into the stomach.
Dr. David Ferson of MD Anderson Cancer Center, Houston, has also found the Lma Pro Seal's higher seal and positive pressure ventilation of benefit.
I think the Lma Pro Seal offers the anesthesia practitioner the opportunity to deliver more effectively the positive pressure ventilation, and also to a great degree it addresses the issue of the regurgitation and aspiration. Right now I feel that we have a new tool, much more powerful tool.
My opinion is that the Pro Seal LMA will offer us increased capability for the use of supraglottic airways in the operating room and will markedly expand our capabilities, particularly in cases where you want very smooth emergence. My impression has been that the incidence of sore throat, hoarseness is markedly diminished by the use of the LMA in general and by the Pro Seal specifically.
Those with experience of using the Lma Pro Seal confirm the benefits of the device both for the patient and the anesthesiologist.
With regard to the Pro Seal versus the classic LMA, I would think that over time it will be proven that this is an advance. I see this as not any different than when we went from uncuffed endotracheal tubes to cuffed endotracheal tubes. I think this is an improved cuff.
In contrast to the classic LMA, the LMA Pro Seal will certainly be more effective in dealing with the issue of regurgitation and aspiration. So it gives us the opportunity to deliver a better care to our patient.
I feel that the Pro Seal will not only be a benefit to clinicians in allowing them comfort of ventilating with positive pressure, it'll also allow them to expand their practice in terms of those patients that they've been hesitant to use an LMA in because of the potential for gastroesophageal reflux.
Almost everything I've encountered with the Pro Seal has been very positive and will advance airway management with a supraglottic airway device. Almost all the features, the increased seal pressure, the gastric port, better patient tolerance of the device are all very positive features of the device. I've really found no negative aspects to the Pro Seal. So I think the Pro Seal is a significant advance and will find very wide application in the practice of anesthesia.